time. Good afternoon, countrymen and women. As of midnight last night, the measures introduced by His Excellency President Edgar Chagwa in his address to the nation on the 25th of March came into effect. As a result of that address, he indicated that a number of non-essential business activities should shut down. This included bars, casinos, nightclubs, gyms, and he also instructed that restaurants should operate only a takeaway and delivery service. As a result of his address to the nation, all international airports are to remain closed except for the Kenneth Kaunda International Airport. And this is to give support particularly to the Ministry of Health to enhance the screening and surveillance of all arrivals in the country. His Excellency once again instructed that all non-essential travel should be stopped and that all arrivals will be screened. On the radio program this morning, I got a lot of calls about what it means to be screened at the airport, and the Minister of Health has been explaining to us in the past updates that those that are showing symptoms of the coronavirus are quarantined in medical facilities, while those that are not showing symptoms but are coming from coronavirus high-risk countries are self-quarantined in their safe space. And I'm sure the Minister later on will explain further on the issue of quarantine, because most of the people who were sending me messages on my media rounds this morning kept asking, why isn't the Minister of Health ordering, or His Excellency the President ordering, that self-quarantine must be policed, because people are quite apprehensive that some people might not observe the self-quarantine. The Minister of Health has continued to advise us in government and as a nation that the response to the coronavirus is not a static plan. It can be scaled up, and the decisions that government is making are informed by the information that we're getting from the Ministry of Health. This morning, the Minister of Finance held a press brief, and in his address to the nation, he did state as well that as part of the fight against the coronavirus, government was going to suspend or waive all charges on financial transactions, on financial transfer of funds of up to 150 kwacha. Again, this is to avoid all of us touching these kwacha notes that might encourage the spread of the disease, and that if possible, let us use all these mobile transfer money services and encourage use of the cards so that we avoid touching of money. The Minister of Health has also advised that we have to continue washing our hands. In public places, we have to continue for convenience sanitizing our hands. What is important is personal hygiene and personal responsibility. If we know somebody who's showing the signs of a cold, a flu, a fever, coughing, headache, please let us report them. Let us report people whom we believe are breaking the law in terms of self-quarantine, because we can only help government, and in particular the efforts of the Minister of Health and his colleagues in the ministry, if all of us do our part. As I came here, Minister, I just got a call from somebody who flew from America 5 days ago, and now they want to go back. And the health officials are advising them that you can't, you haven't even spent 14 days. So these are the challenges we're experiencing, and personal responsibility is extremely important. There is no need to travel now. Stay home, stop the spread, and you will save lives, especially your own life. That is a very, very important message. If we all stay at home and try to avoid public gatherings as much as possible, we are going to be able to save lives. I also just received a note from the Catholic Church, Lusaka Diocese, that they have stopped gatherings and they're only going to encourage maybe personal prayers in the church. Yesterday I did tell you that the Anglicans had also banned all prayers in the church. But let's not move prayers from the church in groups to our houses, because again, we are just going to increase the risk. We all have to use the rule of thumb, common sense, that really, you don't have to gather at all, because that's the only way you're going to be protected. If you don't have to move, please don't move. If you're not feeling well, please stay at home. Government will continue working with you to scale up measures. At this point in time, only non-essential activities have been stopped, but we all have to use common sense to try and save each other's lives. I think that at this point, we are going to get a new update from the Minister of Health. He did give an update yesterday. As you are aware, this disease evolves all the time. And now it's my privilege to introduce the Minister of Health to share with us what is less coronavirus in the last 24 hours. Minister.
Well, thank you very much, Honourable Minister. Good afternoon, ladies and gentlemen. Good afternoon, members of the press. Allow me to update you on the Covid-19 situation in Zambia and globally. Like I have repeatedly said, the government of His Excellency President Kachabalungu is determined to attain universal health coverage. Integral to this health system strengthening agenda is public health security. So as we face this grave threat of the COVID-19 outbreak, we are actually implementing interventions that have been planned for in our health system strengthening agenda. So Zambia is transforming its health sector to focus on health security and ensure that the public is protected from health hazards, and our economic development program is shielded from the shocks of public health challenges. Ladies and gentlemen, due to the diligent follow-up of contacts to the confirmed cases, we've been able to trace and test all primary contacts. I want to emphasize that the first two cases that came from France that were tested positive had all their contacts traced, and we did not record any positive case from the first two contacts. The third case came from a COVID-hit nation called Pakistan, where he had been for 9 months, and returned to Zambia and tested positive, and has been recuperating in our isolation facility. The fourth case traveled to Pakistan on the 9th and returned on the 18th, and we traced all his contacts. We also managed to determine through our diligent surveillance system that there were 26 people that traveled to Pakistan. We managed to track all their contacts and managed to do the tests. We have so far tested 264 suspected individuals. Today, we are running tests for another 25 to complete the whole tree of the contacts for the 26 people who traveled to Pakistan. When we tested the first 8 contacts, they tested positive. That's what brought our number from 4 to 12. When we tested the next 54 contacts, we brought out 4 positive cases. That's what brought our number to 16. When we tested the next 72 contacts in the last 24 hours, 6 were confirmed positive. That brings our total number of laboratory confirmed COVID-19 cases to 22. This 6 out of 72 shows that the number of positive cases out of the numbers that we are tracking is much, much smaller. Further, we note that out of the contacts that we were tracking, There were those who were seated in close proximity, the suspects or those who have already been tested positive on the plane and have been tracked, and that one included one of our residents in Wansha. We followed up that candidate in Wansha, and he tested positive and is currently admitted to Masaiti Hospital. Furthermore, one of the people that traveled to Pakistan and had other contacts in Lusaka and traveled to the Copper Belt has also been tracked and has been tested positive and is the second admission for Masaiti Hospital. In a nutshell, Zambia today has a total of 22 laboratory confirmed cases of COVID-19. 2 are admitted to Masaiti District Hospital in Ndola, which is our isolation facility, while the 20 are being treated and managed here in Lusaka. We have investigated many cases, and out of the many cases that we've investigated, we have managed to isolate some in our isolation facilities at Tuvalange and at Levi, and we have managed to ensure that we've investigated all the suspected cases in isolation that were symptomatic. And it's important to note that 12 who were symptomatic and were admitted in isolation facilities and tested negative rather, have been discharged. They've been discharged. Further, it's also important to note that we have followed up in excess of 3,000 travelers who've come into the country from COVID high-risk countries, and 700 plus have already hit the 14-day quarantine period and have been discharged from the quarantine, self-quarantine. We're still following up close to 1,300 for any symptoms, and I must state that they are cooperating very well to the quarantine rules. That is the current situation, and I want to emphasize that Zambia's surveillance system has been alert enough to pick up suspects. The system has been well structured to isolate suspects, investigate them. Those who are positive managed to keep them in our isolation facilities where we're treating them. And as I speak today, all the 22 that are under our care are stable and are being managed by our health workers. A place of record, our gratitude to our teams that are managing these cases diligently and edge them on. We also want to thank His Excellency President Edgar Chagolungu for escalating this scalable plan and bringing into effect measures that will make it easy for us to restrict or to prevent any new cases. I urge all citizens to be responsible. The measures are very clear. Do not travel to places where there is COVID-19. No need to travel. Even where you are, wash your hands and make sure that you clean your environment. Where you will not be able to wash your hands, use hand sanitizer. Make sure you avoid crowded places. Maintain social distancing. Unity of purpose, discipline, civic responsibility is key for us to win this war. Take personal responsibility. The guidelines that His Excellency President Edgar Chagolungu has given in his address to the nation is very clear about social distancing, about public gatherings. Avoid public gatherings. You know that you run a church And that church has more than 50 congregants already. That church service can take place. You know that you cannot maintain social distancing of a minimum of 1 meter as you are in any congregate settings. You know that can take place. The guidance is very clear on gatherings. If you are not clear and you want to hold a social gathering, apply to the Zambia National Public Health Institute. They will guide you. They will guide you, and you'll be allowed, if only in the provisions of the Public Health Act, Statutory Instrument number 21 and 22, and critically what has been guided in the presidential address. We are emphasizing that social distancing is fundamental for us to disrupt any transmission that may potentially take place. If we don't get any new cases, the natural history of the disease is such that we will be able to have those who get ill, those who get mildly ill recover, those who get severely ill get managed and hopefully recover, and ensure that within a short period of time we are over with this. It will take you and me to be responsible citizens, to ensure hygiene, to avoid crowding, to avoid to avoid handshaking, to ensure hand washing, and avoid congestion, congregate settings. It is that basic. I want to conclude by emphasizing that infection prevention, as emphasized in the Public Health Act, should be something that we must be practiced in all our jurisdictions. His Excellency the President, Dr. Edgar Chagolunga, has directed Cabinet Office to review operations of government and ensure that the essential services are clearly distinguished. And in the coming week, there shall be guidance on who are the essential workers who will be reporting for duty physically and who will be working, anchoring on technology. And that exercise is being carried out by Cabinet Office. All this is a demonstration of commitment to one fundamental in the fight against COVID-19, social distancing, avoiding crowding. Those of you who have been asking questions about buses, minibuses, and so on and so forth, be reassured that one, the minibuses that will be running will carry only the recommended number of passengers and must ensure adequate distance, and must ensure that there are facilities for washing hands or sanitizers. This is critical, and ladies and gentlemen, it will take discipline, it will take unity of purpose, it will take strict adherence to what is prescribed in the statutory instruments, to what is prescribed in the guidelines, in the scalable plan that His Excellency President Edgar Chagulunga has given. It will take collective effort for us to overcome this. We want to thank the President for being proactive. Before we even recorded the first case, a scalable plan was put in place, schools were closed in order for us to close one potential front, and the scalable plan has been implemented and executed in a phased manner. As the epidemic, as the pandemic evolves, new measures shall be announced, and you will be informed accordingly. Tracking contacts is extremely important. It is for this reason that Cabinet Office is working closely with the Ministry to recruit workers urgently to emphasize on contact tracing. The community has a responsibility for you to report to authorities who has been to a COVID high-risk country and has skipped the dragnet, who has been in touch with us. And in the same breath, I must thank the communities that have been very, very alert and reporting to us many such aspects. I want to thank all the cooperative partners that have worked with us in order to support this response. And it's at this juncture that I shall ask Zanako to come forth
As we wait for Zanaco to take their seat, once again, the message is that government is doing its best, but at the end of the day, we have to all work together. And personal responsibility is extremely critical. And the Minister of Health, as he sits here, is looking for all the support he can get. So the private sector in Zambia is being challenged that please don't wait a minute. If you can give support to test kits, to masks, to other personal clothing for the health workers and all frontline workers, this is an opportunity, and we're happy that today Zanaco has come forward because we need all the help that we can get. Go ahead, Zanaco.
Thank you very much, Honorable Minister. Honorable Minister of Health, Honorable Minister of Information, PS, members of the press. I think what we're going through as a nation is very, very critical, and it is something which calls on all of us from all walks of life to come together and support government, especially the ministry, Honorable Minister, to be able to overcome what it is that we're going through. The COVID-19 pandemic has come at a time when nobody was ready, and I think it is in this respect that as Zanaco, we have come in to make sure that we support your ministry in fighting this pandemic. I think earlier on, Honorable Minister of Information and yourself did indicate that we see a lot of problems with regard to non-adherence from, I think, a lot of our people in terms of social distancing. We still see a lot of congestion in a lot of areas. And what this is speaking to is the fact that we need to be able to disseminate the message out there. It has to reach everybody. And not everybody right now is being able to receive that message. And to help the ministry with the communications efforts, Zanaco is placing 1.5 million kwacha to support the ministry in terms of communications. And in addition to that, Honorable Minister, we're also coming in to make sure that I think the situation that was raised regarding the buses and the need to be able to have hygiene materials is also met. So that contribution, that support will come in to help primarily in those two areas. And I think we look forward to working with other government agencies like ZANIS, ZNBC, and all the other private and public sector entities involved to make sure that we do demonstrate that effort to make sure that we achieve what it is that what we were supposed to achieve during this particular period.
Thank you. Thank you very, very much.
No, Honorable Minister.
Thank you very much, Zanaco. Thank you so much.
Thank you very much. That's the 1.5 million kwacha from Zanaco to support our communications and also to support publicity, especially in public places such as bus stops. We still have some time, and we'll be happy to take some questions very, very quickly from our colleagues from the media. First question. Was very, very clear, right? The number now the minister has announced is 22 cases confirmed in Zambia. Our message from government is that we want the private sector to continue to give support. The Minister of Health is still looking for thermometers, is still looking for test kits. So please, it is important that you give us that support. All bars that are open, cinemas, clubs, and gyms, if you are still open up to today, it means that you are breaking the law, and don't be shocked if the police come to visit you. And health workers from Ministry of Health and local government through the statutory instrument 2122 have the power to shut down any such place. Restaurants should only operate service that is takeaway service and delivery. We will continue as government to give you an update. As the Minister of Health has continued to tell all of us, this disease keeps evolving. So as and when a need arises, we'll come back to give you an update. I think what's important to remember, the Minister put it well, it's personal responsibility and participation. We must be all in heightened surveillance of our neighbor, of our families, and ourselves so that we report all cases. Remember, the coronavirus does not move. It is people who move the coronavirus. If you stop moving, the coronavirus will stop moving. If it stops moving, then it will die and will stop it spreading in our community. So please, let us stay at home if we can, and government will continue to give guidance on essential activities for all of us that should continue while others progressively come to a shutdown. It's been wonderful for you to join us, and thank you very much for your time. Thank you.